good morning. This is Dr. Norma Lange-Tagaza, one of the resource persons of the online course on quality improvement. What I'd like to do today is go through 3 modules to enable you to get a deeper insight into the objectives and content of these modules, which are Module 3, Systems Thinking in the Health Sector, Module 5, Patient Safety and Community Engagement, and Module 6, which is on Health Human Resources. So let's start with Module 3, which is on Systems Thinking in the Health Sector. The importance of systems thinking cannot be emphasized. With systems thinking, we understand the interrelationships, interactions, and intercommunication among the different parts of the system. And systems thinking has become a core skill in the health sector or understanding the health system. Why? Because problems in the health sector are very complicated. There are so many people involved. There are so many issues involved. And the more issues, the more people are involved, the higher the risks are in delivery of healthcare. And the issues are so complex, even at the higher level of policymaking. So it is very important that everybody who's involved in improving the healthcare system or improving the quality of healthcare will have a core skill and knowledge about systems thinking. Systems thinking helps us to understand the complexity. And there's one thing I would like to share with you, a saying that is very important: seek complexity and order it. By looking at the complexity of the health system and having a systems thinking, you are helping yourself simplify the complexity. And only when you have simplified the complexity can you really develop responses that are appropriate. So this is the message that I would like to give to you about the importance of this health system. As I said, systems thinking is a core skill. So what we're going to do in this module is to identify the key characteristics of systems approach. And also recognize the systems thinking in quality improvement initiatives. But we're not going to remain on the theoretical discussions about systems thinking. The most important aspect of this module is that you learn to understand or you learn and hopefully apply in your different working situations quality improvement tools using the systems approach. So I hope that is an encouragement enough that begin to develop a systems thinking, a wider view of the whole system and understanding the different factors that interact, that contribute to complexity. Remember, seek complexity and order it. It's a paradox, but I think it's true. So let's move on to patient safety. Now, I ask a question. Have you ever, can you imagine a situation where a patient goes to the hospital for an appendix operation, but comes out of the hospital still with the appendix, but with the gallbladder missing? Or can you imagine a patient suffering from medication problem because the doctor failed to give clear instructions or gave the wrong medication? These are medical errors that are comparatively less dangerous. And they are no longer seldom. There are so many medical errors. Some of them are leading to death and physical disability. And these are wake-up calls that we now in the health sector have begun to think of patient safety. In 2019, WHO reported that globally, hospital-acquired infections afflict about 10% of inpatients. Okay? Medical errors harm some 40% of patients in primary and outpatient care. These are patients that are not confined. They are in primary care, the first entry level in the health system, or in outpatient. 40%, the percentages may not be much, 10%, 40%, you might say, what's that? But in healthcare, where our motto is do no harm, one case of medical error is one too much. As I said, it is a wake-up call. And so patient safety and patient-centered approach have now become core issues in quality improvement in healthcare. And stakeholders, which I talked about in the previous module, are also clamoring for quality care. Take care of us, do us no harm. So we are now talking in quality improvement in healthcare about patient-centered care and person-centered care and patient safety. These will be three of the key issues that we are going to talk about in this module. Patient safety, do no harm. When patients go to us as medical providers, they trust us. They like to come out of the healthcare system healthy and with no harm. The patient-centered approach looks at patient and it is a concept to say we have to listen to the patients. What they tell us, what they don't tell us, that they have a right to complain about the services that they receive from us health providers. And they have a right to ask questions, and they have a right to be listened to. That is being patient-centered. And so we are now moving from doctor-centered approach to patient-centered approach. The person-centered approach is another aspect of patient safety. The patient is not an independent entity. He is part of a community. The community where there are so many social factors that determine his health status. So the person-centered approach look at also at the social determinants of health, the community, the environment in which the patient himself finds in. So these three concepts, patient safety, person-centered approach, and patient-centered approach, are the main issues that we're going to talk about in patient safety. So in this module, you will learn how to incorporate patient safety in quality improvement initiatives. Although from discussions with healthcare providers that, patient safety is too expensive, it's beyond us. We do our best, what happens to the patient is no longer a concern. To a certain extent, yes, patient safety is expensive, but I think we cannot run away from being safe in providing healthcare services. So in this module, you will learn how to incorporate, as I said, patient safety and quality improvement initiatives. You will understand the organizational factors, the human factors, and the structural factors that contribute to the emergence of medical errors. By understanding them, we hope that you will be able to respond appropriately according to the circumstances you find yourselves in your different working situations and in your own countries. So, patient safety, an important factor in quality improvement. Finally, on Module 6 on human resources. Nowadays, with all this encompassing COVID-19 pandemic, we hear a lot about the heroic actions of the health human resources. We call them the modern day heroes. And we clap at them every 8 o'clock in the morning in any country. But that's only an indication of how people appreciate the importance of health human resources. And in some agencies call them also the health human resource as the heart of any social system. Without the heart, nothing beats. Okay, they are the most important inputs in any organization, and yet there are so many problems about health human resources. One of them is migration from developed countries to, the other way around, migration from underdeveloped countries to developed countries, because developed countries are offering them better services, better working conditions. But you know what happens? That the countries where they come from are having problems about lack of health human resources. Another problem is low competence of healthcare staff. Not because they are dumb, but because the quality of education being offered to them are not at par. So people complain about them, but it's not really their fault, I think. And low motivation. If you look at the daily schedule of a normal healthcare staff, overworked, underpaid, unhealthy working conditions, and they put themselves also in danger. And then there's too much specialization for heart, for every part of the body, which creates an imbalance. So these are some of the problems that are involving human resources in health. But I think if we improve the working conditions of health care staff, motivate them not only with money, but good working environment that will also keep them safe, then we will be having good quality or good performance of healthcare staff. So all these problems that I mentioned contribute to the problems or to the high turnover healthcare staff. In this module, we're going to explore because I think it's so complicated that we'll be able to offer concrete steps, but we're going to explore how human resources and appropriate change interventions can contribute to the achievement of quality healthcare. The main topics to be discussed in this module are leadership and change management, strategic planning, and team development, because healthcare staff always works within a team. Underlying all these topics is the need to develop a culture of quality and safety among healthcare staff. It's a complicated issue, but we're going to take the topics one by one. So I hope I have given you some insights and into these modules, giving you an understanding of the objectives and the content. Finally, I would like to say that these modules will be theory-based, practice-oriented, and student-focused. We know that all of you are coming from different regions. All of you are coming from different working situations. Not all the things will be one by one appropriate to your situation, but we feel that you will have enough understanding to adjust what you learn from these modules that are in accordance to the realities of your working situation. So I hope that you will be able to join us in this quality improvement case. Let's work on this together. Thank you.